Chase, tell us a little bit about what your job is and what's your role with the patients.
My role here, I am a certified hyperbaric technologist. I am also the safety director for the hospital here, and actually just in the hyperbarics. My role is to make sure that the patients are safe, make sure that everything is safe for staff, patient, pretty much the whole hospital with our department.
Okay, and your job is when the patient comes in, you load them into the chamber, and then you help educate them, and you're here with them the whole time. Tell me a little bit about that experience.
Pretty much what happens is the patient will show up, get on the bed, we take vitals pre and post, make sure that they are completely comfortable, make sure that they have all materials on them that, or should I say, don't have the materials on them that we don't want going inside the chamber, because it is 100% oxygen, so there always is the potential for fire. Once we slide them in, I can communicate with them via the telephone, talk to them back and forth just like I'm talking to you, make sure that they're able to clear their ears, make sure that what they want to watch on TV is what they want to watch, that they're comfortable. Pretty much that, you know, they're okay. They're in there for 2 hours. Slide them out, make sure everything's fine. If they have wound care that day, or if they're ready to go home, treatment is about 2 hours long.
So I know we're talking about wounds that maybe someone's had for a long time that have had difficulty healing. When they have a wound that is specific to the wound chamber, how many treatments can you expect for them to have over a given time?
What we do say is that we normally say between 20 and 40 treatments. It all depends on the progression of the wound. If the wound is looking better, we'll do less treatments. If it's looking worse, we'll feasibly do more. Thing is that the chamber is not only just for wounds. We actually have carbon monoxide poisoning is one of them, cyanide poisoning, decompression sickness. I mean, all these things can be treated. They are approved indications for Medicare and Medicaid. There are 13 approved indications. So wounds is just kind of one of them. And the carbon monoxide is a big one, especially for this area when it starts to get cold. People start bringing their generators inside, having problems with that.
So this is actually a great addition to Logan Regional Hospital, that now we can provide this great service. And we have someone such as yourself that is very well trained. You have lots of experience. How long have you been working in this kind of field?
In this field, I've been doing it about 5 years. I went to commercial dive school to be working offshore as a diver about 5 years ago. I also had training as a medic for divers. And then I got into the clinical aspect about 4 years ago, and actually just moved here about a week ago.
Congratulations. We love having you as an addition to the Valley, as well as the hyperbaric chamber. So this runs Monday through Friday, okay? And about how many patients can you see in a given day?
On a given day right now, we're going to be, the maximum we're going to do, I believe, is about 6, because each treatment is 2 hours long or close to it. For safety matters and all that good stuff, we like to have a little bit of time, make sure that, you know, everything is smooth, everything is good, patient's safe, everything, and slide them in. So about 6 patients a day.
That's terrific. That's wonderful. And then you also get to work with some amazing physicians and staff here that also helps the whole experience really great for the patient, I would assume.
Yes, ma'am.
That's very good. Well, this is an exciting new facility here at the Logan Regional Hospital. Great to meet you, Chase, and glad that we have your expertise to help you with any kind of healing that you might have.